Dr. Hall, you are a geriatric nephrologist and clinical investigator, and you have come on the Young Nephrologist Platform ASN Exchange Program here to Budapest to deliver a lecture on medications in older adults with kidney disease. What are the special challenges which doctors face when they treat elderly CKD patients in general?
Mm-hmm. Well, that's a good question. One of the main things that we should be concerned about when we're treating elderly patients with kidney disease is not only that this patient has kidney disease, but also that they tend to have other chronic conditions. And so managing their kidney disease may interfere with how they manage their other conditions like a diabetes, hypertension, or any other psychiatric diagnoses or prior cancers. One other things that we have to be concerned about is whether our patients who are older may now have some geriatric problems like difficulty with cognition or falls or functional impairment. And the concern with those geriatric conditions is that it may make it harder for those patients to manage their kidney disease on their own.
What are the special challenges with respect to pharmacokinetics and dynamics?
Mm-hmm. And so as I will discuss in my talk is that one main concern is that with older age, some medications do tend to have different pharmacokinetics and pharmacodynamics. You add on top of that being having older age and having kidney disease, we now have patients who may have difficulty clearing not only medications that depend on the kidneys for clearance, but also medications that do not rely on the kidneys, but may actually have interference by uremic toxins who may make it harder for clearance. Given that, what we see is that the dose response is prolonged, and so these patients may have an increased likelihood of experiencing the adverse drug effects.
Mm-hmm. And how often do elderly patients receive potentially inappropriate medications, and what are the risks?
Mm-hmm. There is significant data on the use of potentially inappropriate medications in older adults in general, but a lot less data is out there for patients with CKD and or on dialysis. From the literature so far, one could say that the prevalence is between 30 and 60%, with the 60% being more among those who are receiving dialysis.
Mm-hmm. And why is it especially important to educate nephrologists in this matter?
Mm-hmm. Well, I think the key thing about educating nephrologists is that we all need to understand the potential risk associated with these medications. They're called potentially inappropriate because these are medications that in older adults, they may carry more risks than benefits. And so while there is not a lot of specific literature to date on the potential risk of different medications, some in particular though I can comment on, like some psychoactive medications in dialysis patients may increase their risk of altered mental status or falls or fractures. And so as more evidence evolves, I think it's important for nephrologists to consider not prescribing those medications and also looking at their current patients and consider whether some of those medications should be discontinued.
Thank you very much.
Mm-hmm.